Good afternoon, and today's presentation will be on AVNEM, Addressing Vaccinations in New and Expecting Mothers. AVNEM's authors are Ali Hawkinson, William Spears, Paige Vigmased, Krista Norby, Jenna Bergmark, and Diana Rahabi. What is AVNEM? AVNEM's goal is to educate parents on the importance of vaccinations through pamphlets and flyers and hopes to increase vaccination rates across San Diego County, which could significantly decrease the amount of vaccine-preventable diseases overall. Currently, over 20% of grade school level students in Southern California do not have their routine vaccinations. We believe much of this is due to the lack of education from healthcare professionals to parents on why vaccinating is so important. AVNEM's purpose is to educate parents on why their children need to be vaccinated to decrease the overall amount of unimmunized children in San Diego County. AVNEM objectives. Number 1. By the end of the intervention, 80% of parents will be able to list 3 vaccine-preventable diseases. Number 2. By the end of our program, parents will be educated thoroughly on how many lives are lost to vaccine-preventable diseases each year. Number 3. By the end of our program, parents will be educated thoroughly on how many lives are saved each year due to vaccine-preventable diseases. Number 4. By the end of our intervention, rates of vaccinations across San Diego County will increase by 25%. The model AVNEM will be using is the conceptual model. As you can see, we have 4 different factors on the left: perceived susceptibility of contracting a vaccine-preventable disease, perceived seriousness of outcomes such as death and disease from lack of vaccination, perceived benefits of receiving recommended vaccinations, perceived barriers of receiving the recommended vaccinations. The 2 factors on the top left, perceived susceptibility and perceived seriousness, will then lead to perceived threat. 1 child dies every second from a vaccine-preventable disease. The other 2 factors on the bottom left, perceived benefits and perceived barriers, will lead to outcome expectations, cue to action. Educate parents on benefits of vaccinations and to reduce negative stigmas. The perceived threat and the outcome expectations, cue to actions, will eventually lead to self-efficacy to vaccinate their children based on recommendations. Outcome measurement. There will be 2 ways we will measure our outcomes. Number 1, objectively, through quantitative assessing the reduction in anti-vaccine waivers given to local schools by new or expecting mothers. Number 2, subjectively, through questionnaires handed out to the mothers asking their opinion on vaccinations before and after the program implementation. Research design. We will be taking survey measurements before the study and at the end of the study. We will be using a quasi-experimental design because we will not be doing random assignment to the groups. We will be comparing the rates of vaccines in elementary school students that we go to versus the elementary school students that we do not go to. We will be working on a generous budget. We will be comparing the mothers that we educated to the mothers that we did not educate, and you can see the design example below. This now concludes our presentation, and thank you.